The journey to becoming an expert caregiver to those living with dementia starts with the basics. CARE's Dementia Basics is designed for professionals who work in long-term or home care settings. It is also a solid introduction to person-centered care in any care setting.
Person-centered care to me is really just looking at that person as a whole human being. It's not about a bunch of tasks to be done, but it's about giving that person the dignity and respect they deserve for their life.
Accepting or knowing that our reality isn't necessarily reality for the person who has dementia, and that has to be okay.
It's so simple. It's just treat somebody how you'd like to be treated.
Learn to recognize the stages that those living with Alzheimer's go through and how to modify your approach accordingly.
Notice how carefully Frances watches herself in the mirror, how skillfully she uses the comb. Now Frank is able to use his old familiar electric razor, and he watches himself carefully in the mirror. But he needed a little help getting set up and started, even though it's an old familiar razor.
Here, I'll have you go ahead and put it on. Let me switch to the other side.
The reason I switched to the other side is that I know Susie's dominant hand is her right hand, and I want to use the skill that she's practiced for many years.
You hold to me and I'll put it on.
Okay.
What we often call behavior is probably a way to communicate. They can't tell you any longer, I need 2 Tylenol over here, my shoulder really hurts.
What possesses you to do something like that?
And so staff just need to understand that what we often see as behavior is communication.
It's impossible for you to do a good job if you're not patient. You have to be a patient person. Just look at it on the line as, okay, this can be my mom or dad, grandmother, grandfather. And if you can do those 2 things, you will be fine.
CARES and the CARES approach have never been more important. I can't stress enough how important it is for you to really take hold of what CARES is about, what CARES means, and using it during these very challenging times to be successful in providing care.
You can get some.
Marianne was a busy homemaker and likes to help in the kitchen. On most mornings, Sita, the aide, assists Marianne in the kitchen with the morning snack. Knowing that Marianne should bathe today, Sita decides to take advantage of this time when Marianne is content and well connected with her. Later, you'll see how Sita guides Marianne to the bathroom without mentioning a shower.
You gotta make sure it's all clean, huh? Okay.
Sita realizes that Marianne is concerned about the dirty counter, so she responds by giving her a minute to wash off the counter before they continue making the toast.
You wanna open up the bread? Can you do that?
Sita knows that Marianne is able to do most of the steps herself, so she prompts her along the way. Keeping her involved in the activity makes it more meaningful and enjoyable for Marianne.
You can put the toast in here now. Put 2 slices in here. Are you gonna have that now?
Yeah.
All right.
Sita can see that Marianne is enjoying making and eating her toast. This has been a great way to connect and build trust with Marianne. Marianne seems very content, and Sita decides this would be a good time to walk with her down to the bath area.
Now, what do you think about this?
I don't know, what is this?
This is a bathtub.
Sita was much more successful getting Marianne to the bath area using this approach. After chatting for a few more minutes, Marianne agrees to try the bathtub. Sita should share with the team that Marianne can get upset at the mention of a shower out of the blue. Be creative and make use of activities that you'll be doing with Marianne during the day when she feels comfortable with you to transition her to a personal care activity like bathing.
In addition to premium video content, CARES courses are full of interactive activities, knowledge checks, and supplemental worksheets, so you can take notes and complete exercises in ways that you will remember and put into practice. At the end of the program, you may access a free, fully integrated online certification exam, thereby earning the CARES Dementia Basics certification. After finishing with Basics, you can earn 7 more certifications, take a credentialing exam, and become a credentialed CARES Dementia Specialist.
When we're working with our residents with dementia, everything we do centers around just treating someone with dignity and respect and honor them for who they are.
The most confused person can respond in a very positive way if you treat them with genuine love, with dignity.